Hi, I'm Lori Handy. I'll be speaking to you today from the Vaccine Education Center at Children's Hospital of Philadelphia. Today we'll be talking about cough. So to start off, what exactly is a cough? It's a very general symptom indicating that something in a child's airway is being irritated. What ends up happening is that irritation kicks off a nerve reflex where then your body tries to expel air to get rid of that irritation, and out comes the cough. So that might be an infection like a virus or a bacteria, or it can be something non-infectious like asthma, reflux, even a foreign body getting stuck in place. For today, we'll really focus on infections. So there's a couple ways that we can get a cough after getting sick. One is just the physical irritation. Imagine your nose is congested, there's all sorts of mucus. This can kind of drip down to the back of your throat. And again, your nerve reflex is just to try and get rid of that. However, viruses and bacteria can also directly invade the lining of your airways, whether that's right at the back of your throat, lower down in the upper airway, or even down in the lungs. All of that will result in cough. So the question is, when is this dangerous? You want to think about how your child's managing the cough. Are they living their regular life, able to eat and drink, but occasionally coughing? That's okay. If instead they're having difficulty breathing, color change, or using a lot of muscles to breathe, where you see tugging around the clavicle or their ribs, or unable to complete full sentences, that's a sign that they're really working too hard to breathe and you need to contact your child's doctor. If your child's well enough to be symptomatically treated at home, I'm often asked, what can I give my child? The first thing to know is that over-the-counter cough medicines really should not be used in children under 6. They haven't been shown to be effective. And for children as young as 2, they actually can cause harm. So you want to stay away from those. Instead, think about the things that can just provide symptomatic relief for your child. Often that's warm fluids, warm mist, grandma's chicken soup, a hot drink, if they're able to do that. Or some children may benefit from something that just soothes the area. That might be a spoonful of honey. You can give that if your child's over a year of age. Or for older children, something like a cough lozenge. Every once in a while, people tell me that a popsicle or something cool actually feels better. And again, if that's what symptomatically makes your child feel better until they recover, go ahead and try that. At the end of their illness, you might notice their cough lingers, and that's normal. That's their body repairing itself after some damage to the airway. And eventually that symptom will completely resolve, but it will take time and a bit of patience. Thank you for listening today.